This is the Team A project. We'll be talking about the Institute for Culinary and Medical Intervention, or ICMI, which is a culinary medicine after-school program we hope to start in Newark, New Jersey, and then expand it to other parts of the state and the country. Over the past number of years, there's been an increasing understanding, concern, and a call for action with respect to the healthcare disparities that we see along racial, socioeconomic, and geographic strata. This is particularly impactful in the inner city, where there is an epidemic of diabetes and obesity in younger children, as well as chronic diseases in this population. It's estimated that 40% of people living in Newark, New Jersey are in food deserts, which are areas that have no access to healthy, affordable foods, and 28% of children in Newark live in these areas. This impacts the overall health of the population, predisposing them to these chronic conditions, particularly diabetes and obesity. Childhood obesity rates in Newark have reached nearly 40%. Adult onset diabetes is twice the state's average in Newark. We believe that these statistics can be changed with education and intervention, and it's key to start with our children at a young age. ICMI is dedicated to changing lives through culinary medicine, focusing on the power of education as well as food and nutrition to prevent chronic diseases such as diabetes and heart disease. Our team is a diverse group of individuals who each have expertise in medicine, health education, nutrition, community engagement, and technology development. Together, the group has created ICMI not only to educate children, but also engage their families and communities.
Thank you, Paul. We introduce an innovation that blends health and education to transform the future of Newark children. Children in Newark are affected by obesity, and diabetes rates are double the state average. We believe this crisis cannot be solved with treatment alone. Prevention is key, and the ICMI program is our solution. Our unique approach combines culinary education and medical intervention to teach children how to prepare healthy meals, understand nutrition, and make better food choices. But it doesn't stop there. Parents, schools, and the community are actively involved, creating a network of support for lasting change. For every dollar invested, this program saves $10 in future healthcare costs, showing that prevention is not just smart, it's essential. And what makes this program even better is it is scalable, designed to expand and benefit other communities. Together, we can empower children to build healthy habits from a young age. Join us in creating a healthier and brighter future, started with Newark. Thank you.
Our value proposition is to use the opportunity to intervene in the growing epidemic of obesity and chronic conditions in underserved neighborhoods. The culinary medicine focused after-school program aims to instill lifelong nutritional habits in children and in young adults. The area of population that is going to be used is Newark, New Jersey. We see 4 key benefits in regards to our value proposition. The first one being health benefits. So ICMI intervenes at a crucial development stage by teaching children healthy eating habits, directly preventing the onset of chronic conditions such as obesity, diabetes, and heart disease. Also, community engagement. We actively engage parents, schools, and community organizations to extend the benefit of the program beyond the classroom. By involving the broader community, we create a support system that reinforces healthy habits at home. There's also cost effectiveness. ICMI not only provides immediate educational benefits, but reduces long-term healthcare costs. Prevention through education is far more cost effective than treating chronic conditions later in life. And finally, sustainability. Our programs are designed to be scalable and sustainable, allowing ICMI to expand to other communities and continue addressing the health needs of underserved populations. In regards to our target audience, the primary location for the initial rollout is Newark, New Jersey. The obesity rate in Newark is almost 40%, significantly higher than the state average of 30%. The diagnosed diabetes rate is 15.7%, almost double the state rate. 25% of Newark households rely on SNAP benefits, and many families live in food deserts with limited access to healthy food. These statistics highlight the urgent need for a program like ICMI to provide children with the education and tools to make healthier choices. We'll be focusing on children 1st to 12th grade in underserved communities, their parents, and the broader community. And the target audience is going to be school districts, community leaders, healthcare organizations, and potential investors, both public and private, such as venture capitalists, government programs, and charitable foundations. Some statistics just to show the need in Newark. So in regards to income and financial security, you can see that Newark citywide had a much lower household income from 2016 to 2020 versus even the county and the state of New Jersey. In regards to chronic conditions, Newark citywide has a much higher obesity rate, a higher diagnosed diabetes rate, and a higher percent of population with high cholesterol than the state of New Jersey. In addition, 57% surveyed agreed that my community has a safe outdoor place to walk and play, which is a very low number. For violent crime rate per 100,000 people, Newark citywide is vastly higher than the state of New Jersey and the county of Essex. And finally, in regards to access to healthcare, 17.6% of Newark remains uninsured, with 8.8% under 19 years old also uninsured. And 25.4% of Newark households are on SNAP. Some additional food insecurity and obesity statistics for Newark are present in this slide. In the top left, we can see the breakdown of food insecurity in the city, broken down by different races and ethnicities. But you can see that there are 33% roughly of respondents reporting food insecurity, the largest percentage of that being Hispanic and Latino at 44%. In the bottom left, we can see the percentage population with food insecurity in both New Jersey and Essex County in 2019 and in 2020. You can see that Essex County, where Newark is located, reported higher than state average percent food insecurity by the population. In the top right, we can see the breakdown of the top 3 health issues in the community, the number 1 being overweight and obesity at 33%, and the number 3 being many cases of diabetes at 19%. Finally, in the bottom right, we can see a breakdown of how often students and children are either physically active or sedentary after school. And you can see that for many of these populations, specifically Hispanic and Latino, a large amount of this time is not spent physically active.
For our marketing analysis, we want to highlight that it's critical to engage our stakeholders such as parents, guardians, decision makers in the school system, and healthcare professionals to successfully deliver our program to our main target consumers, which are the children 6 through 18 years of age, which is the impressionable age development when children are starting to think for themselves and are eager to practice independence. We acknowledge that there are federal and state programs that can enhance our business model. And as far as competition, we realize that they are out there. However, ICMI is positioned to provide an advantage due to a combined focus on targeted consumers and streamlined curriculum platform, which provides for a more concentrated package integrated within after-school enrichment and culinary medicine-focused programs. Healthy promoting behaviors established among children and adolescents equates to a higher level of healthy relationships and success in adult life. We all know that healthy eating is essential to a child's growth and development and decreases the risk of developing chronic medical problems. A study conducted by the Rockefeller Foundation concludes that for every dollar spent on school meals alone, there is a return of more than $2 back. Our program intends to reinforce this fact through an intense cost accounting process to continuously promote the full value and opportunities that our business model brings to the table. We have broken down the future engineering of our ICMI program into 4 sections. Locally hiring for staff encourages and promotes a culture of personal investment in the community. Strong curriculum development is important for content value. Strategic campaigns through health fairs, billboards, TV mobile applications, frequent surveying, and hosting regular community events helps penetrate and reinforces the program into the community's awareness. Collaboration with local state and federal programs for fundraising and grants assist with offsetting some of the financial cost. And finally, and the most important, is developing sustaining relationships with parents and school officials who could be strong advocates for the program. The argument for the health and economic benefits of our program continues on this slide. The first year's operating budget is projected to cost around $948,000, which covers staffing, facility, equipment, food costs, and other expenditures. The program also emphasizes the ROI on local economic development by prioritizing hirings within the community. The scalability of our program is modifiable and adaptable to other community settings that encounters similar challenges. This is a forecast of the annual operations cost, and as you can see, there is a significant budget for human resources. Recruiting and retaining skilled nutritionists, dietitian, and cooking instructors is not a luxury for the celebrities anymore. We have defined that these personnel are crucial elements in the ICMI success as they bring up-to-date medically recognized expertise and skills into our program. We have sectioned our strategy into four areas and aimed our efforts into three major components for focus and avoid wasteful strategies. In the financial approach, we centered on securing long-term funding and grants, including maximizing use of federal USDA program dollars, mindful fund diversification, and constant evaluation of expenses. For customer value, we aim for customized curriculum, concentrate on continuous engagement with stakeholders, and allow for continuous performance improvement through feedback and surveys. Internal organizational development centers on continuous growth for our human resources and business efficiency improvements. And lastly, for learning and growth, concentrate on R&D and professional development with a focus on culinary medicine and children's nutrition. ICMI will be a not-for-profit nutrition program for all targeted Newark children and adolescents free of charge. Our goals are first to intervene at the early stages of childhood development and equip this population with the proper tools and resources to promote healthy decision-making skills to impact their future. Evidence through academic reports and literature strongly suggests that these interventions contribute significantly to decrease food insecurities, and by promoting nutrition and by prioritizing the efforts on children, we see sustained healthy habits that is carried on towards their adult life.
I would like to thank Paul, Colin, Zoila, and May for their presentation. I would now like to talk about the implementation process and call to action, starting with the SWOT analysis. The strength of the program is that it is a unique offering tailored to each age group. It is evidence-based practice of culinary medicine programs in the United States. Employment for trained professionals in the field of culinary medicine and nutritional directions. Opportunities are we can partner with the hospitals around the neighborhood, intervene in response to community desires for nutritional support and chronic condition, and potential research and legislative policy changes. The weakness, of course, are limited functional allocation and funding programs, parent and guardians or school support to transport students to the center and back home, resource constraints to be able to support the demand of the program. The threats are curriculum is not sensitive to language and cultural barriers and preferences of the students and families, potential community resistance to culinary medical practices, and regulatory compliance changes. ICMI program will be offered to the children Monday through Thursday from 4 p.m. to 8 p.m. at a mutually agreed location set by the school district. For example, the program will look like from 4 to 4:30 there will be a discussion of the meals to be prepared. From 4:30 to 6:15 there will be a guided tutorial on the value of healthy eating and medical interventions. 6:15 to 7 p.m. the group will be led by dietitians, nutritionists, and medical providers. From 7 to 8 p.m., students will enjoy their meal and be prepared to take over any leftover food for home. The capacity will be inclusive of 18 students initially. Monday through Wednesday, there will be ages 6 to 12 that will be accompanied by their siblings, and Tuesday, Thursday, ages 12 through 18 can be accommodated. Each night, the staff will be consistent of one cooking instructor, one dietitian nutritionist, one medical provider, and one administrative staff. This slide shows you the timeline of ICMI from launch to implementation and future planning. It is a very carefully thought out process, with phase 4 showing a program implementation evaluation taking the longest time period. Strongly believe that longitudinal measures of success for fueling the future by changing individual behavior within this age group has immense benefits. It will decrease childhood obesity rates in Newark, New Jersey. It would increase the emphasis on nutrition, home cooking, culinary medical practices. It will decrease the long term or longitudinal risk for development of adult obesity and morbidities of diabetes, high cholesterol, and heart disease. Dietary modification to include more balanced options and increase in the access of healthier and nutritional options for children adolescents in Newark. Our next steps for call to action would be to determine partners with aligned values, identify a location for fueling the future with the school district, create a proposed research and analytic framework for measuring success, finalize the annual operating projection, and secure funding. Together with Paul, Colin, Zoila, May, and myself, Shankari Ravichandran, we hereby call you to join us in building the future of Newark children. By investing in ICMI, you're investing in the future of Newark's children. We're giving them the tools they need to lead healthier lives and build a brighter future. Together, we believe we can fight the epidemic of obesity and prevent chronic diseases and empower the children and families with the knowledge they need to succeed. We invite you to partner with us in this life changing endeavor. Whether through funding, partnership, or community support, your involvement will be a lasting impact. I will now take any questions. Thank you for listening.